Mosquitoes follow the same overall body plan of other insects. They have a head, a thorax, and an abdomen. And the most characteristic part of the mosquito is the head, because all mosquitoes have a long proboscis. That proboscis is what they use to feed on animals, people, etc. Inside the proboscis are a series of very thin, cutting mouth parts called stylets. When a mosquito feeds on you, she is actually bending back what you see as the proboscis. That's actually just a sheath covering the stylets that are gonna drill through your skin and go down and feed on you. Once those stylets get under the skin, they find a capillary and they're able to suck up the blood. All the time that a mosquito is looking to feed on you, she is salivating into your body. I know it's really gross, but that's what you react to, the itchiness. That's also the opportunity for the pathogen to get outside of a mosquito and into a person. In addition to the proboscis on the head of the mosquito, there are antennae. Antennae are a little bit like the nose for an insect. That's where there's a lot of reception of airborne chemicals. In the case of mosquitoes, they have specialized receptors for different molecules that you might find in the air, including carbon dioxide, one of the major attractants, as well as other smells associated with animals or people that they're going to use to find their host to feed on. In addition to the antennae, they also have eyes, and their eyes function a little bit like our eyes. They're for visual reception. Mosquitoes see into the infrared so they can detect heat as well, and they're also going to use that to find a host and feed on. Now, when we think about the internal anatomy of the mosquito, we can also start with the mouth parts. So the mouth parts go down and they're going to take in a blood meal. That blood meal is going to go straight into the digestive tract of the mosquito. Most of the digestion for a mosquito occurs in the midgut. That's kind of the center portion of the digestive tract. The blood is actually covered with a membrane. This is to help protect the mosquito from anything it doesn't really want in its own body. This is also a barrier for a pathogen getting out of a blood meal and into the mosquito. However, pathogens are able to do this. They cross this membrane and then they get out of the midgut or stomach of the mosquito, and then the pathogen will migrate through the body of the mosquito to the head. Either the salivary glands, in the case of a virus or malaria parasite, or in the case of a worm, of which mosquitoes transmit many, the worm is just too big to get into the salivary gland, and so they just live in the head. Now, I already mentioned how important the saliva is when a mosquito is feeding. She is constantly spitting, so it makes sense that if you were a pathogen in a mosquito and you want to be transmitted to the next person, you would live in the salivary glands. Those worms that live in the head of the mosquito, they actually crawl just right down the proboscis of the mosquito into where the bite is on the skin of a person or a dog, say for dog heartworm. So after we get past the head of the mosquito, we have the thorax. The thorax of the mosquito, and true for most insects, is kind of what everything attaches to. It is the site of locomotion. It's where the 6 legs of the mosquito attaches and where the 1 pair of wings attach. It has a lot of the musculature, so you have to be able to flap your wings, so you need muscles, and that all is in the thorax. Most of the other internal parts of the mosquito are actually in the abdomen, the digestive tract, as well as the reproductive parts of the mosquito. In the case of a female mosquito, she has a pair of ovaries and something called a spermatheca. This is where she's going to store sperm from her usually one mating and then release those sperm as she's laying her eggs. The ovaries are the site of egg production, and when she gets her blood meal, she will convert the protein in the blood meal into the protein to provide nutrition for her eggs, as well as the baby or neonate or little tiny first instar mosquito larvae, which are essentially there, but they're inside the eggshell. Once eggs are developed, a female mosquito will go and look for a place to lay her eggs. She's using the same kind of sensory cues, or at least sensory inputs that she used to find a host, but now she's looking for a good place to lay her eggs. So she's going to look for water. She's going to essentially smell the water and determine whether that's a really good place to lay eggs and have her babies grow up. And she's also going to use some visual cues looking for water surfaces. Many of these things depend on the species for the exact cues that she's using, but once she finds a place she thinks is good enough, she's going to lay eggs there. The major sensory inputs for the mosquitoes are the antenna, which in large part is a chemosensory organ, essentially akin to our nose, as well as the tarsi, which are the forelegs, the front legs of the mosquito, in which is essentially how a mosquito tastes the world. They also have taste receptors on the tip of their proboscis. They'll also take input from their eyes, as well as other input from their antennae. There's some vibration, stuff like that. Repellents, in large part, work by disrupting the input of the sensation that a host is nearby and that a host is good to feed on. And they do this by binding to the receptors in the antenna, and this sends false signals to the mosquito and essentially confuses her about whether she should be feeding or not. Now, there's some other insecticides and repellents that work by overstimulating the nervous system in general, and that works in a little bit different. It's not directly targeting the sensory input, but essentially generally targeting the nervous system of the mosquito.